Scientists have been working with developing RNA vaccines since the 1980s. So we're talking about 20 to 30 years ago. People came with the idea of using RNA as a potential vaccine. Several scientists and several companies already were investing money and effort to develop these RNA vaccines against the flu and against other bacteria, and also against SARS, because remember, SARS-CoV-1. SARS-CoV-1 was the SARS that came in 2003, and people knew that in the virology field that could potentially another coronavirus could come in the future. So they were already working with SARS and another coronavirus called MERS to develop these RNA vaccines. So it's nothing new about that. They were already working on it, and unfortunately for us, SARS-CoV-2 showed up in 2019. I hear a lot this from a lot of people. They said, this is a new vaccine. We don't know if I can trust it for what happened in 5-10 years when I take this vaccine. I will always tell them, this is a new virus. We don't know what's going to happen in 5-10 years after you get infected with this virus. I prefer to go and use a new vaccine that most likely not going to have side effects in 5-10 years than get infected with a virus that we just right now trying to understand how that works. And maybe in 5-10 years, you can have actually issues because you got infected with this new virus. So I think it's super important to get vaccinated no matter what age you are. Number one, because I said before, this is a new virus. Even though you get infected, you don't feel sick. You don't know what is the consequences in a year, 2 years, 5 years, 10 years from now. We don't know because it's a new virus. That's number one. Number two, like I said before, the more people are vaccinated, less room you give to the virus to mutate. So even though you don't get sick, that means that if you're vaccinated, the virus, even though it can infect you, they cannot have time to mutate. So that's a way to reduce the amount of variants in the future if there's more people vaccinated. And number three, again, you're not going to make it for you, make it for your family, make it for your community. I know everybody's sick and tired of wearing masks. I know everybody wants to go back to our normal life of going to concerts and going to stadiums and stuff like that. Do it for that. Just do it for that. Even if it's not related to your health, do it for the community so everybody can go back and have, again, a normal life.